Welcome to another lesson as we cover neurologic diagnostic procedures. Encephalography. The purpose of an EEG is to perform a non-invasive procedure that assesses the electrical activity of the brain and is used to determine abnormalities in brainwave patterns. An EEG provides information about the ability of the brain to function and highlights areas of abnormality. EEGs are most commonly performed to identify and determine seizure activity, but they are also useful for detecting sleep disorders and behavioral changes. Important key points to know. Pre-procedure. Nursing actions. Review medications with the provider to determine if they should be continued prior to this procedure. Client education. Wash the hair to eliminate all oils, gels, and sprays. Stay awake prior to the test. Being sleep deprived provides cranial stress, increasing the possibility of abnormal electrical activity, such as seizure potentials, occurring during the procedure. To stimulate electrical activity during the test, you might be exposed to bright flashing lights or asked to hyperventilate for 3 to 4 minutes. Avoid taking any stimulant or sedative medication 12 to 24 hours prior to the procedure. Intra Procedure. The procedure generally takes 45 to 120 minutes. There are no risks associated with this procedure. With the client resting in a chair or lying in bed, small electrodes are placed on the scalp and connected to a brainwave machine or computer. Electrical signals produced by the brain are recorded by the machine or computer in the form of wavy lines. This documents brain activity. Notations are made when stimuli are presented or when sleep occurs. Flashes of light or pictures can be used during the procedure to assess the client's response to stimuli. Post-procedure. Client education. Glasgow Coma Scale. The purpose of this assessment is to concentrate on neurologic function, and it is useful to determine the level of consciousness and monitor response to treatment. How it works. The Glasgow Coma Scale is reported as a number that allows providers to immediately determine if neurologic changes have occurred. GCS scores are helpful in determining changes in the level of consciousness for clients who have head injuries, space-occupying lesions or cerebral infarctions, and encephalitis. This is important because complications related to neurologic injuries can occur rapidly and require immediate treatment. Important key points to know. GCS scores are calculated by using appropriate stimuli, a painful stimulus can be necessary, and then assessing the client's response in 3 areas. Eye opening, E. The best eye response with responses ranging from 4 to 1. 4 equals eye opening occurs spontaneously. 3 equals eye opening occurs secondary to sound. 2. Eye opening occurs secondary to pain. 1 equals eye opening does not occur. Verbal, V. The best verbal response with responses ranging from 5 to 1. 5 equals conversation is coherent and oriented. 4 equals conversation is incoherent and disoriented. 3 equals words are spoken but inappropriately. 2 equals sounds are made but no words. 1 equals vocalization does not occur. Motor, M. The best motor response with responses ranging from 6 to 1. 6 equals commands are followed. 5 equals local reaction to pain occurs. 4 equals general withdrawal from pain. 3 equals decorticate posture, adduction of arms, flexion of elbows and wrists is present. 2 equals decerebrate posture, adduction of arms, extension of elbows and wrists is present. 1 equals motor response does not occur. Responses within each subscale are added, with the total score quantitatively describing the client's level of consciousness. E plus V plus M equals total GCS. In critical situations where head injury is present and close monitoring is required, subscale results may also be documented. Thus, a GCS may be reported as either a single number, indicating the sum of the subscales, 3 to 15, or as three numbers, one from each subscale result, and the total, E3V3M4, equals GCS 10. This allows providers to determine specific neurologic function. Intubation limits the ability to use GCS sum scores. If intubation is present, the GCS may be reported as 2 scores, with modification noted. This is generally reported by totaling the eye and motor score and recording it with a T, such as GCS 5T, with a T representing the intubation tube. Interpretation of findings. The best possible GCS score is 15. In general, total scores of the GCS correlate with a degree or level of coma. A score less than 8 is associated with severe head injury and coma. A score of 9 to 12 indicates a moderate head injury. A score greater than 13 is associated with minor head trauma. That ends the lesson on neurologic diagnostic procedures. Check out our other nursing videos to help make studying easier. Also, see below for useful links that take you to NCLEX style quizzes, nursing study guides, and more.